A seizure is a paroxysmal disorder of cerebral function characterized by an attack involving changes in the state of consciousness, motor activity, or sensory phenomena. An aura is a specific sensation preceding a seizure, lasting from 1 to several seconds. These sensations can be feelings of numbness, unusual smell perception, peculiar sound perception, or feelings of nausea or fear.
I'm so stressed out. Is anyone done with this relax assignment? It's due tomorrow.
Negative.
I haven't even started Professor Watson's nutrition paper that's due on Wednesday.
Just wing it.
I'm so stressed. I cannot wait for break. What are you guys doing over break?
Not really anything fun. What about you?
Well, I'm gonna go see the boys in Scrubs, so it's gonna be pretty sick.
Really?
Yeah.
Are you into
The different types of seizures are simple partial seizures, which do not alter consciousness, and complex partial seizures, which do alter or impair consciousness. However, these both can turn into generalized seizures in which the patient loses consciousness and the situation can become life-threatening.
That sounds like so much fun. I love Boys and Scrubs. I've never been to a rave before either.
Neither have I.
Are you guys kidding me right now? Like, Tauntaun, you had to have been to a rave before.
Yeah, I have.
Wow.
Are they fun? I mean, what do you do?
Well,
What
you
are they
guys
like?
should come with me. It's gonna be fun. We
Okay,
can
let's make
pregame
a
at my
plan.
house
Perfect.
and go to Finn's next,
Oh.
and maybe even in and out that sound.
That girl is a real crowd, please. Small world, all her friends know of me. Young bull living like an old geese.
Oh, it must be that hot chick in the back. Oh,
So-
what was that?
Yeah, did you...
What's up, guys?
Are you
What?
okay?
You guys okay?
Are you
No,
just
are
like
you
dozing
okay?
off in the distance over there?
No, I don't. You guys.
Well, anyway, let's just move on. When is it? Like,
Yeah, we need to know. Dates,
Wait, what were we
time,
talking about before?
at the concert
I
plan,
can't remember.
Oh,
the
right,
rave,
yeah.
whatever.
So I don't remember. Let me look on my phone real quick. Oh yeah, so it's coming up like in the middle of December. You guys gonna be able to make it?
Yeah, I think
Check my calendar.
after finals that would probably be fun, don't you think? Whoa, whoa.
Are you okay, Sierra?
Whoa.
Looks like you're having like a seizure or something.
Are you okay?
Do you need?
So this is what you may see in different types of seizures. In a simple partial seizure, the patient will have involuntary movements, déjà vu, or a perception of an odor that does not exist. In a complex partial seizure, the patient may appear spaced out, have a repetitive behavior, or have amnesia. In an absent seizure, also called a petit mal, the patient will have no aura but will have a sudden and blank stare that's often short in duration. In a grand mal, the patient will have muscular contractions, which is called the tonic phase, clenched teeth, and flexion and relaxation, which is called the clonic phase. In a Jacksonian seizure, the seizure begins at a distal muscle of one limb with a jerking motion or paresthesia of the face. There are 3 different causes of seizures. A symptomatic seizure is caused by an underlying brain lesion, for example, a tumor. A cryptogenic seizure is caused by an underlying lesion that is suspected, but it can't be identified. An idiopathic seizure is caused by an underlying lesion that is neither identified nor suspected. Some triggers of seizures are flashing lights, fatigue, alcohol ingestion, and stress.
I love you, Tinder.
Love you, Tinder! Woo! Oh my gosh! I love them! Yeah! Wait, dude. You okay? You okay? Everybody, stop the concert! I think he's having a seizure.
So there are different ways you want to manage different types of seizures. In an absence and partial seizure, you want to recognize the problem, terminate the dental procedure, activate the office emergency team, position the patient, and reassure them. In a grand mal seizure, you want to follow the PCAB sequence and position the patient supine, maintain an open airway, prevent injury, administer oxygen, and monitor vitals. In a grand mal status, also called a status epilepticus, which can be life-threatening, you want to activate EMS to be able to administer benzodiazepines. After the seizure, you want to place the patient on his or her side in recovery position.
Okay, we need to, go get some oxygen. Okay, head tilt, chin lift. Okay. Alright, got the oxygen?
Okay, I have the oxygen.
Okay, awesome. Alright, can you, it's been a while, he's still not getting ready, or getting better. What do you think?
You might be having an episode, like status epilepticus.
Okay, you need to call EMS now. Oxygen.
We're at the Boys in Scrubs concert, and this guy, he's just having a seizure, and it's been like over 5 minutes, and he won't stop. We need help. Okay, they're on their way.
Okay, good.
Oh, EMS is
Hi,
here.
hi. Okay, so he's really hot. I think he has a fever, but what do you say about his pulse?
His pulse is really rapid. Okay.
We're thinking he's having like a status epilepticus seizure?
Yeah, he is, and he needs benzodiazepine, which I have. and
Okay.
That will stop the seizures, but he needs to be sent to a hospital right away.
Can't wait to see it. Dang it!
Bro, go.
Oh,
Dude,
you can't
that
do
was
one
good.
Yeah, this is gonna be my first rape. Stop saying that!